A couple of more minutes and start promptly at 12 noon. Let me give it just about another minute and then we'll get started. All right, well, it is noontime where I am and 9 o'clock on the West Coast. And for all you others in between, it's either 11 or 10 a.m. So I want to welcome you to AMET Skin Cancer's webinar series, Skin Cancer in You. I am your host, Krista Rubin, nurse practitioner and AMET Skin Cancer's Ask a Skin Cancer Nurse. For those of you who may be joining the webinar and are not familiar with our organization, AMET Skin Cancer is a foundation dedicated to raising awareness and providing support for those affected by skin cancer. And our webinar series is designed to explore a comprehensive array of topics surrounding skin cancer treatment, management, and the emotional health of those affected. So I welcome you and thank you for joining us. And joining us here today is Kathleen Madden. Kathy is a nurse practitioner in the Melanoma Center at NYU Langone Medical Center in New York City. Kathy's been a nurse for over 30 years and a nurse practitioner for over 20 of those years. Her practice specialty is melanoma and other skin cancers. She's involved with clinical research and has taught, lectured, authored, and written extensively on the topic of melanoma and non-melanoma skin cancers, as well as other skin malignancies. And Kathy also holds numerous certifications in holistic nursing, which is a little bit off the beaten path, and integrative care techniques. I always enjoy having Kathy join me for webinars, and I welcome you here today. Kathy, thanks for joining me.
Thank you, Krista, so much. And thank you to AIM for inviting me back. I just love speaking to this audience. I feel that it's very near and dear to our hearts, to the everyday work that we do with people. And the conversations, I think, are just so meaningful.
Yeah, agreed. Okay. So we're here today to talk about communication with healthcare providers, either during treatment or after treatment or even before treatment. And one of the things that I was thinking about as I was preparing for this is that communication is probably not something that we consciously think about how to effectively communicate. It's not like we say, okay, we have an appointment today and I'm going to effectively communicate with my provider. But really, it is something that's kind of done on a subconscious level. But we really need to be thinking about it and being, I guess, more straightforward about our communication strategies. So hopefully you and I can come up with some strategies that may be effective for others involved. So I think I'll start with, what is good communication? Why is communication so important, particularly in the context of a healthcare appointment?
So I think realistically, as I was thinking about this and preparing, I was envisioning what the patient journey and what that patient support network journey looks like. Nobody expects to end up in the oncologist's office. Nobody expects to end up in the surgical oncologist's office, radiation oncology office, or an infusion center. A lot of times when people are diagnosed with skin cancers, they're like, well, just cut it off and they just move on. And a lot of times
Yeah.
that's true. That's true. That can be a very curative measure. But then in practices like ours, we see patients who have more advanced situations or situations that are not ready for surgery yet, or situations that may not be ready for surgery. So, some of the big things to do is to take a breath and process what's going on. And some people have never been in the healthcare system. Some people don't like to engage in the healthcare system, or some people have been engaged in the healthcare system a lot. So there's a huge spectrum for patients that I know that we encounter in our practices, and meeting them where they're at with the type of support that they need. And in terms of communication, there's lots of documents. AIM is one of the places where you can find information. What are the questions that I should ask? And there's no wrong questions. I think the only wrong question is the one that's not asked. We don't want people going home having, well, maybe, sorta, kinda, I don't know. And being able to, at least on a very minimal level, explain what's going on with themselves, so that way they can have to check back so they understand. Because the more understanding, then the better level of decision making that can be made. So, starting off with writing questions down, I think this is
That's
certainly happened.
tremendous. That's
This
tremendous. Yeah.
It's happened to me at appointments with family members or even myself. And certainly with patients, sometimes we hear news that we weren't expecting to hear.
Right.
Sometimes we get off on a conversation where we didn't know how involved it might get.
Hmm.
And so having those questions written down is an anchor point. And that way you can go, okay, wait, but I still have some more questions. And sometimes you can start with them at the beginning of the appointment, or they get processed and baked into the appointment as it rolls out.
Yeah, that's a really good point too, because I think sometimes we get just distracted or head in a direction, not thinking. And then at the end, you say, oh, I should have asked this. I meant to ask it. And I think what's also a good idea is having those questions written down in a notebook or in a place where there's room for you to also take notes and then refer back. We know that patients hear about 20% of what is said during a visit, 20%. So that means the majority of the information isn't necessarily captured. And so I do believe that writing notes down is certainly an old-fashioned way to do it, but very, very effective. And then, at a next appointment, you have that in front of you to be able to say, I didn't really understand that. Can we go over this again? Or my notes aren't clear, or I'm not sure what you meant, et cetera, et cetera. But you're right, it's people don't expect to be in the oncology office. And that alone is intimidating. And I know
Mhm.
in Boston, where I practice, traffic, parking, many people are so stressed by the time they finally do make it up to the office that they can't, it's hard to get your thoughts
Yeah.
together. Yeah.
Um, One of the other important things too, Krista, that you brought up is that, maybe people have difficulty writing. Maybe people don't write as quickly. I know I talk a lot. You'll see that in the next 25 minutes. There's a lot of information that happens. And I've also had a situation where perhaps the patient has some memory issues, but not so significant that, that they can't navigate their way, and they have a partner or a support network person with them. I've been asked, not a lot, but on several occasions throughout the years, may I record our conversation?
Mm-hmm.
And
Hmm.
so, as long as you ask for permission and that it's mutually agreed upon, I think that we try to behave like we're being recorded all the time anyway. But sometimes that's helpful for the support person at
Hmm.
home to say, no, let's listen back with what Krista said. Let's listen back with what the doctor said. No, here, it's so that way. Again, sometimes there's relationship dynamics, and that can be a little bit helpful too, if writing things down, or a way to check back and verify notes that were written.
That's a great, great thought. And of course, in some states, it is illegal to record without the person being recorded aware of that. So asking permission is
Hmm.
key. And that was something I learned
Hmm.
recently. I was not aware of that law, but certainly asking permission. And it is a great way to go back and listen to that conversation again. And then that the individual, the patient, isn't then responsible for having to relay everything that was said. Because often family members
Yeah.
or children, sometimes adult children will say, well, mom or dad, what did they say in the appointment? And then that person is then responsible and can't always remember. And then children or others can get frustrated, et cetera. So I think that's a great piece of advice. There are many ways to communicate. And, many individuals that have advanced skin cancer are a little bit older. We
Hmm.
regularly see people in their 70s, 80s, 90s, and they may be less familiar with technology or less comfortable using technology. So again, strategies include the writing or the
Hmm.
listening. And then there are you mentioned our website, AIM has great information. And there are certainly resources out there to help you kind of gather your thoughts and put together in a concise and an order of priority what's important to you to discuss at
Hmm.
a visit. Which brings me to my next thought is that can you talk a little bit about the importance of being honest, kind of partnering with your provider at visits. Often people don't know what to expect at a visit, so it may be hard for them to come up with questions to ask, or they don't know what they're going to hear.
Hmm.
So talk a little bit about like framing the importance of advocating for yourself, partnering with your team, and kind of what that means, what that may look like.
Well, I think you brought up a really great point. The fact that we generally deal with folks who are in later decades. And so they have a lot of life experience. A lot of people do have some higher healthcare experience and literacy. But again, as you said, sometimes that doesn't always keep up with the technology. I think that, being honest about the fact that the generational gaps in terms of information acquirement, technology engagement, it's very highly variable. COVID definitely pushed, I think, some of our older generation into a forced space. And there's a lot more availability where people may be using computers and online, but I still have some patients who don't have smartphones. Nothing wrong with that. They have a flip phone. So, not that I text with my patients a lot, but I know that that's not someone as maybe another measure that I can reach them at. Or my aunt who refuses to use her phone as she just takes incoming calls on it. Excuse me, outgoing calls. She doesn't take incoming calls on it. She doesn't have an answering machine. So, knowing what that individual's preference is and how to access them and where their technology literacy is, so that way we can provide them with information. Because saying, oh, well, watch this amazing video online, and maybe they don't go online, they don't have a computer, maybe they just have an email account, they don't feel comfortable with it. I've had a
Mhm.
lot of people come in with a smartphone and go, I don't know, my grandson helps me with it. And there's opportunity there where we can, if somebody's willing and feels comfortable, where we can teach them maybe how to use their MyChart app. Oh, okay, here's where you look at that, here's how you do that. um,
And what you mean by that, to interrupt, is what we call the patient portal, or
right.
accessing notes and information through your own patient chart.
That's right. Not everybody has that exact medical record access. But yes, accessing that patient portal can be very important. Sometimes patients get left behind when things get shifted. But I think one of the main things is establishing trust. And, we understand that people are coming into the office. They're vulnerable. They're sometimes not sure why they're there. Maybe the surgeon has referred them, and they're like, I don't understand. I have the surgeon, like, why do I need you? And so you can gauge, where are we at with this? Allow me to explain. And it's really important as the provider that we recognize where patients are at and engage them and ask them what their expectation of the visit is. Someone tells you they don't know why they're there. Well, that's opportunity to explain why. If other people come in, you start off, tell me what's been going on. Help me understand, your understanding of today's visit, so we can calibrate expectations, so that way we can have a successful engagement. And I feel like if we immediately include people in as the providers, it starts to establish a quick trust rapport. There's more to developing trust. And let's face it, relationships in regular life take time to build trust. We don't always have the luxury of time to develop that trust. We have to do it very quickly, but it's bi-directional. So we are putting ourselves out there as the providers, inviting the patients in. And as you said, it takes time to process the information. And we do want people to listen to all of the information so they can make the best informed decision that aligns with their goals. And establishing what their goals for themselves is extremely important. And I think that that's one of the building blocks of establishing that rapport with building trust.
Yeah, so that was a lot of information that was incredibly right on too. And so I want to just kind of tease out a couple of things that you said. One being, one of the things I'm hearing is that it really is on the provider. But I think too, we have to meet our patients halfway and vice versa. That one of the things I like to ask people is, how do you learn best? What is the best way for us to provide information to you? For some people, hearing it, they tune us out after about, 10 minutes in the visit. It's overwhelming. So the rest of the speech, so to speak, is just not really heard. And so I think too, as providers, what we need to do is be able to quickly assess how we can help somebody, how we can try to establish that relationship, try to earn that individual and caregivers' trust, and figure out a way that we can both understand each other best. And what I think I see, or what I know I see with many folks of older ages, is that they grew up in an era where you never questioned the doctor or the nurse. You kind of, here's what we recommend and that's it, or here's what we're telling you to do, and that's it. And that's difficult to be able to then just change the way you're thinking and question a provider. So what I always like to say to my patients is, like, you're the expert on you, and we're the experts on the drugs and the treatment. And so together we formulate a plan that's individualized to you and works best for you. But patients have to be their own best advocates, and their voice and what they have to say is really important. What are some strategies that you use in your clinic to really be able to emphasize that point, that what they say is important? And honesty really has to be fundamental to the relationship.
Honesty is 110% fundamental. Just like you, Krista, I invite my patients in and their support network persons, their family, their friend with them, or maybe it may be a hired care provider. I like to ask them, how do you like to receive your information? Do you like sort of like a broad, big picture, or do you like to get into the nitty gritty? Sometimes also knowing what someone's profession is or was can be very helpful. An engineer is going to want the nitty gritty. Someone who may be in another career, they say, you know what, I'm just give me the basics, give me the overview, please. And it's important to know how the other person or persons like to get that information, because while one person may want an overview, the other person may want nitty gritty, and sussing out that maybe not all of that information can be conveyed during that visit. And also sussing out the importance that even though someone may want broad strokes, there may be some specifics that they might need. But to the point that you brought up about being honest and questioning the care provider, I brought up multi-generational before, and that my mom was a BSN nurse in the early 1960s. That was a very rare breed of nurse at that time. There were other avenues that were more popular and common. And even my higher level BSN prepared mom, when I went in for a tonsillectomy at the age of 21, I questioned the nurse giving me medication. And my mother said, "You don't question the nurse." You know, this gray-haired nurse who replied back to me, "What are you, a pharmacist?" And I said, "No, I'm a senior in nursing school and I want to know what medication you're giving me." And she goes, "Oh." And then she shared with me the anesthesia that she was giving me. So even people who can be familiar with healthcare, high level prepared, but engaging people, but also asking those honest questions and not being afraid or ashamed that, you know, you might be perceived as something, or maybe something is a little bit more intimate in terms of a personal function, where there may be a medication that may be affected, or going into treatment that may be something important. I encourage people, don't be embarrassed. We're healthcare providers, we're trained professionals, you're in a safe space, and that it's a professional space, and it's there for your optimal good. And the more that we know, then the better service that we can be for you and your family and your support network. Everybody in your support network is important who supports you. And just being able to ask questions, and even if maybe you don't feel a little bit comfortable, again, write them down. We do take everyone seriously, because again, you're the expert in yourself. And I could never tell someone, "Oh, this is the best thing, it's the right thing for you." It's a partnership. And I try to tell patients, you know, we're your guides and navigators on this journey. Yes, we do have the scientific and the healthcare information, and we're here for your safety first and foremost. We want good outcomes, but we're here to also keep you safe. We don't want any harm to come to you. That's why it's so important to let us know what's going on with you at the onset, and to let us know if you have any hesitations, reservations, or wanted to try something else like a herbal medication or a supplement. Someone very trusted and well-meaning in your support network had a great idea and said, "Hey, you have cancer, try this." Ask first. This is a circumstance where we're there for your safety, and we're there as guides. And maybe something might be a no for a short period of time during treatment, but we'll give you a reason. We'll share with you. But the more we share with each other, that builds that partnership and trust, and that you're the head of the team, you're the captain of the team. And again, we take your lead, but sometimes we'll take the lead if you're struggling or having difficulty.
I think it's important that, you know, hopefully all providers are sending the same message, but there may be some providers that you don't feel are listening to you. And so in a situation like that, it's okay to advocate for yourself and say something like, "I don't feel like you're hearing me, or you're not listening to me, or I don't feel like my concerns are being heard." You have every right as a patient or as a caregiver to address that. And that provider should stop and have that conversation with you. Well, tell me why you don't feel like you're being heard, or what is it that I'm misunderstanding? And I think for some, the idea of that would be confrontational, or many patients want to be that good patient. I want to be a good patient. I don't want to give you any trouble. I don't want to cause any stirs. But at the same time, that patient is the one that may not be getting ultimately what he or she or they need. So advocating for yourself is totally fine and should happen.
And Krista, that's an excellent point, because while you and I and the people that we work with and the majority of people that we engage with across the country are very empathic, very compassionate, patient. But yeah, I do know that, like, there's a clock and a time, and so, and not everybody is created equally, and everybody's human. Some people have bad days, but if you feel that you're rushed and that you're not being heard, and you leave an appointment upset or didn't feel that everything was covered, I mentioned that patient portal. Kristen, I mentioned that, and that may be a way of providing some additional written information and some feedback. And oftentimes becomes a part of the personal chart. If that's not a way that's comfortable, then an email or some way of getting another written message to your provider. Um, or if you don't feel comfortable, but there's somebody in your support network that does, that you feel you can trust to advocate for you as a partner, that's another way of being able to get some information that maybe wasn't covered or wasn't clear. So be that advocate, because ultimately this is about you. It's about the patient. It's about your life.
Mhm. Yeah, and so as we're getting short on time, again, I love speaking with you because I think that you have some great ideas and thoughts. So I want to just end with a couple things. One, what about those individuals that may not have a large support network or really not have any support network? What are the strategies that you use for patients that come to their visits alone or really don't have anybody or don't want to involve anybody from their support network in their care? That kind of increases the level of concern for some patients. So how do you handle that? What works in your practice?
So for me, having been at this for, quite some time, I'm fairly good at discerning which of those patients may be very high risk. And I, try to get to know them, but then I take a pause and say, I try to dive in a little bit deeper, and not to be intrusive, but to be inquisitive and inquiring about how can we best support you? And we know that you're fiercely independent, and we don't want anything to happen with that. So we want to go back to establishing what that individual's goals are and identifying that they're an independent person and they like it that way, and that they don't want to have a lot of people overwhelming them and involved. And so offering them opportunities for online supports where they can look at information on their own privately, offering them supportive care services such as social work services. Our center does require that our patients do have one point of contact, and letting patients know what the resources are. And I think sometimes just for the provider, if they start a new treatment, that may be a patient that we might need to reach out to maybe a little bit more frequently. But I may also ask the same. Again, this is bi-directional. We're all adults and we're all accountable for our actions and what we do, and we take responsibility. So developing that partnership with someone who prefers to have limited engagement from outside, it does make it more challenging, especially if there are difficulties or disruptions to their everyday. And just being in touch with your team and expressing and letting us know. That doesn't mean we're going to launch somebody to your home, but it does help us better understand, do we need to look at this treatment option? Do we need to make any adjustments? What can we do to best support you? Again, to keep you safe and meet all of the objectives and goals.
Yeah, and I think, not everybody needs somebody at appointments with them.
Mhm.
Not everybody really, many people go through treatment, follow up independently without involving family members or friends or others, and that's their choice. And of course, we respect that. I think that the concern is during treatment, the reason we like to have others involved is because what if there's a day that you as the patient just don't feel great? you don't feel great, you don't have the energy to get yourself meals. So we
Mhm.
like to know that there's a backup in your life that can help with some of the everyday living things, like going to the grocery store. If you don't really feel well enough to prepare a meal at home, how are you going to really get yourself to the grocery store or things like that? So
Yeah.
the purpose of us kind of assessing and trying to determine who the supports are for an individual is really about how do we keep somebody in their own home as healthy as possible and support them. And cancer is sometimes an all-encompassing
Mhm.
entity in itself. And as the saying goes, it takes a village. Sometimes it really does take many resources to help an individual live as optimally and feel as optimally as possible. So I just wanted to give that perspective as to why we as providers often really delve into the what are the available resources, et cetera, et cetera. Do you ever get that question from patients? Like, why are you asking me so many questions about
Yes.
who's around? And
Yes. And it's because we've seen how things can go.
right,
And it's we're coming from a vantage point of the expert. We've seen when patients make decisions that are not in the best choices for their outcomes and their
right,
safety. And we don't want those things to happen because we see how that trajectory goes, and we don't want to have to escalate somebody checking in on someone. We would much rather call a family member or a friend, someone that they've designated as a trusted person, and be a second point of contact. Oh, and or just know, like, we worry about our
right,
patients. We want to know that, like, okay, all right, if you're not feeling good, you have someone who can go pick up. Sometimes patients call and they need a new prescription, and if they don't have a pharmacy that delivers, and it's not right across the street, and they're not feeling well enough to go get it, that's a concern for us.
right.
Unexpected things do happen from time to time, and we need to have some preparedness for that. And knowing that there are people who can step in to help is really important. Part of
Super.
that village.
Great information you provided to us today, and I hope it was helpful for our audience. I want to thank our audience for participating. Please check out the AIM at Skin Cancer website. There are a tremendous amount of resources, videos. Also check out our videos on YouTube and Facebook. And again, Kathy Madden from NYU. I so appreciate you joining me today. And thanks
Thank you
again to
so
those of you that
much.
have joined. All right. Have a great day, everybody.